If you or someone you love is one of the millions living with geographic atrophy, or GA, you know the story has often been a frustrating one. Watch and wait as vision fades. But what if that story is finally changing? Today, we're diving into some groundbreaking new analysis that shows how you can actually take the fight for your sight back into your own hands.
So let's just quickly level set. What exactly is geographic atrophy? Well, it's the advanced, dry form of age-related macular degeneration. You can think of it like this. Parts of your retina, that's the super important light-sensitive tissue at the back of your eye, they just slowly and irreversibly wear away. It's a leading cause of blindness, and for so many, its progression can feel totally relentless.
And honestly, this has been the most infuriating part for so many patients. For years, the standard approach was just to monitor the disease as it got worse. This whole watch and wait strategy left people feeling completely powerless, like they were just a passenger on a journey they had zero control over.
Okay, but what if that's all wrong? That's the huge question we're tackling today, because a deep, new analysis of major eye studies is basically flipping that old script on its head. The evidence is now pointing to the fact that you are not just a passenger. Your daily choices, they can be an incredibly powerful tool in this fight.
So where does this breakthrough come from? It's from understanding that GA isn't just one single battle. It's really a story in two parts. You could call it a tale of two stages. And this is so important. What causes the disease to start isn't necessarily what causes it to get worse. That distinction is a total game changer. So, look, here are the two different battles, side by side. On the one hand, you've got the risk factors for just getting AMD in the first place. Certain genes play a big role, and things like a diet low in fish can be a factor. But then on the other hand, once GA is already started, the whole game changes. A different set of genes becomes the main driver. And, get this, at this stage, eating fish doesn't seem to have that same protective effect anymore. The battle lines have totally shifted.
This is what some researchers are calling the fish paradox, and it perfectly explains this new way of thinking. While the omega-3s in fish are great for helping to prevent AMD, the data just doesn't show that they do much to slow down GA once it's there. The takeaway here is absolutely crucial. If you already have GA, your strategy has to adapt.
Right, so if fish isn't the hero when it comes to slowing down progression, then what is? This brings us to the real power of your plate. The evidence we're seeing on how specific foods can directly impact the speed of vision loss is, well, it's pretty amazing. Just take a look at this. It's so clear. What we're seeing is the rate of GA growth per year. For folks who didn't really stick to a Mediterranean diet, their lesions grew at almost 0.3 millimeters a year. But look over at the group who really went for it. Their rate drops all the way down to about 0.25. Now, that might sound like a tiny difference, but believe me, when you compound that year after year, it means saving more of your precious retina and your sight. So let's break this diet down into some simple heroes and villains. The number one hero for slowing this thing down? Whole fruit. The absolute biggest villain? Red meat. And as we said, fish is kind of neutral in this specific fight. Oh, and healthy fats, like you find in olive oil, they play a really strong supporting role. It's a simple framework, but it's incredibly powerful. Okay, let's put a hard number on that villain. The people who ate the most red meat saw their GA lesions grow at an average rate of 0.312 millimeters per year. That's the fastest progression rate the researchers found for any dietary factor. And now for our hero. The group that ate the most whole fruit, their progression rate was just 0.247 millimeters per year. Just put those two numbers next to each other for a second. The difference is huge. This isn't just some minor adjustment, this is a profound shift in the disease's path, and it's driven by what's on your fork. All right, moving on from diet, we have to talk about the single most damaging lifestyle factor there is. When it comes to speeding up vision loss in people with GA, the evidence against smoking is, well, there's just no arguing with it. It's an unambiguous accelerator. And here's the number that should honestly stop everyone in their tracks. A current smoker with GA is almost 4 times more likely to suffer a catastrophic drop in vision. We're talking losing 3 or more lines on an eye chart in the single year compared to a non-smoker. No other choice you can make carries this level of risk for rapid functional blindness. It's just that simple. So with all of this incredible new information, the watch and wait era is officially over. It is time for a proactive, evidence-based game plan. Let's pull everything we've learned together into a clear set of actions. Okay, here it is, your GA game plan, all in one place. First, really try to stick to a Mediterranean diet that slows the overall growth.
Within that diet, make sure you're boosting your whole fruit intake. It's your best protector. At the same time, you gotta limit red meat, which is the biggest accelerator. Next, and this is a big one, you have to stop smoking. It's the key to preventing that rapid vision loss. And finally, talk to your doctor about the ARDS2 supplement formula. For some patients, this specific blend of vitamins can really help protect that crucial central vision.
And let's be really clear about how powerful these changes are. The effect you get from really sticking to that Mediterranean diet is in the same ballpark as some of the new injectable medical therapies for GA. So this isn't some secondary, nice-to-do strategy. This is a foundational therapy that works right alongside medical treatment.
You know, this quote from the research really says it all. Your genetics might set the stage, but they do not write the entire script. The environment inside your eye, the day-to-day stress your retinal cells are under, can be changed, and you are the one with the power to change it.
So, the focus now really shifts from all this data back to you. The science has given us a roadmap. It shows that you have real power, real agency in the fight to save your sight. So the only question left is the one right here on the screen. What's your first step going to be?